Your doctor has prescribed Lazonda. Inside your Lazonda pack, you will find prescribing information, a medication guide, a disposal pouch, and a child-resistant container, which holds a bottle of Lazonda. The following video provides direction on how to prepare, how to use, and properly dispose of your Lazonda medication. It will cover the 5 different stages that are important to know when using Lazonda: how to prime or prepare the spray for use, how to use, how to determine the number of sprays used, how to properly store Lazonda, and how to correctly and safely dispose of the medication and bottle. Stage 1. Opening the Lazonda container. The Lazonda spray comes in a special child-resistant container. It is important that the spray bottle be returned to the child-resistant container after each use. This will help prevent others from accidentally taking or being exposed to Lazonda. The Lazonda container is opened by squeezing the raised tabs on the cap and twisting the cap to remove it. Stage 2. Preparing Lazonda for use. Before you use a new bottle of Lazonda, it needs to be prepared. This process is called priming. An unused bottle of Lazonda shows 2 thin red lines in the counting window in the white plastic top on the bottle. Remove the plastic protective cap from the nozzle of the Lazonda nasal spray bottle. Place the tip into the opening of the pouch provided and hold it upright so that the spray goes into the pouch. You will find it easiest if you hold Lazonda upright with your first and middle fingers on the grips. Firmly press down on the grips and then release. You will hear a click. A wide red bar will now be visible in the counting window. Repeat this process of pressing and releasing 3 more times. Once, twice, 3 times. As you keep on pressing and releasing the bottle, the red bar will become smaller until you see a green bar in the counting window. The green bar means that Lazonda is ready for use. Remove the tip of the bottle from the pouch. Remember, do not seal the pouch or throw it away. Place the pouch back in the box it came in for later use. You will need it for the disposal of any remaining liquid in the bottle. If you lose your pouch, use a pouch from another Lazonda pack to prime and dispose of unused medicine from this bottle as well as from the next bottle. If you do not have an empty pouch available, please call the Archimedes phone number listed in the medication guide. You will receive the replacement pouch in the mail. If you are not going to take your medicine right away, replace the protective cap. Put the Lazonda bottle back into the child-resistant container and put the cap back on the container. Put the container back in the cardboard box. Wash your hands with soap and water. Lazonda must be used within 5 days of last use and within 14 days after priming. Stage 3. Using Lazonda. Before you use Lazonda, check that the bottle is ready for use. A bottle that is ready to be used has a green bar or a number visible in the counting window. If you have a runny nose, blow your nose now. Remove the protective cap from the nozzle. Sit up with your head upright and hold the bottle with your thumb on the bottom of the bottle and your first and middle fingers on the finger grips. Insert the tip a short distance, about a ½ inch, into your nose. Point the tip toward the top of your nose, which will tilt the bottle slightly. Close the other nostril with one finger. Firmly press down the finger grips until you hear a click, making sure that the tip stays inside the nose. Remember, you may not feel the spray go into your nose. Do not sniff after spraying the medicine into your nose. You will know that a full spray has been given when you hear a click. In addition, you will be able to see that the number in the counting window has increased by 1. This tells you that a full spray has been dispensed. Breathe in gently through your nose and out through your mouth. Avoid blowing your nose for at least 30 minutes after each spray. If the dose your doctor has prescribed requires a second spray, the second spray must be administered through the other nostril. Do not use more than the dose that your doctor prescribed to treat any single pain episode. Stay seated for 1 minute after using Lazonda. After each spray, the number in the counting window will increase by 1. Replace the protective cap on the tip of the bottle. Return the bottle to the child-resistant container after each use and store securely out of the reach of children. Stage 4. Number of sprays in a Lazanda bottle. There are 8 full sprays in each Lazanda bottle. After the first spray, the number 1 will appear in the counting window. This will go up by 1 each time a full spray is administered. When a red number 8 is seen in the counting window, the bottle is finished and you will no longer be able to obtain a full spray from it. Stage 5. Disposing of Lazanda. All Lazanda bottles that are no longer needed must be properly disposed of. Before you throw away a Lazanda bottle, you must empty all remaining medicine into the pouch. This is to protect others, especially children, from harm. If you have not used all 8 sprays, there are still doses of Lazanda in the bottle. You must empty the remaining doses from the bottle by spraying into the pouch until a red 8 appears in the counting window. Once the red number 8 appears in the window, empty the remaining medicine into the pouch by pressing down on the finger grips a total of 4 times. You will feel some increased resistance when you press down, and you will not hear a click. The counter will stay on 8. Put the protective cap back on the spray bottle and put the empty bottle back into the child-resistant container. Seal the pouch by removing the tear-off strip from the flap and folding it over to stick it to the pouch. Place the sealed pouch in the child-resistant container. Throw the child-resistant container with the empty bottle and sealed pouch inside it into the trash. Wash your hands with soap and water right away.